Hi, my name is Amanda Little, and I'm going to be doing my informational speech on how to recognize opiate drug abuse and how to react to an opiate drug overdose. In 2012, there were almost 10,000 overdose deaths from opiate painkillers and almost 4,000 overdose deaths from heroin. These numbers continue to rise as addiction to opiates become more of a growing trend. Recognizing signs of an opiate addiction and overdose can help save a loved one or even a stranger who struggle with addiction. I personally know how important it is to recognize the signs of an overdose. My brother overdosed on methadone, which is a opiate prescribed most commonly to help those trying to overcome addiction to heroin. He went into respiratory distress in his sleep. His lungs filled with fluid and his respiratory system started to shut down. I luckily went to his house early that morning to pick up my niece, and his girlfriend told me that he was still sleeping. I went in his bedroom to wake him up, be a big sister, be a nuisance, and I immediately noticed the swelling of his face. I tried to wake him, and that is when I noticed him aspirating. I called 911 and tried to administer CPR, but his airways were so filled with fluid from him laying like that all night that the CPR was not working. I rolled him on his side to try to alleviate any of the fluid while waiting for EMS, and that is when I felt him relieve himself and he died. Luckily, EMS came in and they were able to revive him. It's my hopes that with this speech, I can explain how to recognize an opiate addiction and how to respond to an opiate overdose. I will be describing what an opiate drug is and how it is used. I will be explaining ways to recognize opiate drug abuse and overdose symptoms, and I will also be explaining how to react to an overdose and steps you can take to save a life. Opiates are a narcotic that work by directly depressing the central nervous system. They attach to proteins called opiate receptors in the brain, spinal cord, and gastrointestinal tract. And they block the transmission of pain. The brain has many receptors for opiates. An overdose occurs when too much of any opiate, like heroin or Oxycontin, fits into too many receptors, slowing and then stopping breathing. This is what an opiate overdose looks like. Heroin is the most commonly used opiate. Some of the common opiates prescribed for pain are morphine, Norco, Vicodin, and Oxycontin. Prescription opiates are very addictive and often lead to the use of heroin. Aside from the oral use of pills, heroin is typically injected or snorted. Intravenous injection gives the user the greatest intensity with the most rapid onset, so it is the most popular method of use. There are a couple telltale signs to look for when needing to know if an individual is high. Nodding out is a big one. If they're sitting at the dinner table and nodding out in their plate, then there is a problem, and you need to recognize that. Scratching is another thing to look for when a person is high, because they tend to scratch a lot and they cannot control the itching. Small pupils and slurred speech are also signs to look for, but not always as evident if you're not talking to the individual in question or unable to look them in the eye. IV users will also have track marks. Track marks are the penetration marks from the needle, and there will almost always be bruising. Track marks are commonly on the arms, back of the knee, and feet. Anywhere there's an accessible vein, really. When you have an addict in your life, every waking moment can be a nightmare. There's always that possibility that they will overdose. So learning how to recognize an overdose is a great idea and can ultimately save a life. Recognizing signs of an overdose is crucial. It's very rare for someone to die immediately from an overdose. So if you know what to look for, then you can help prevent them from dying. If someone is making odd noises while they appear to be asleep, go out now. It is worth it to try to wake them and stimulate them. In many cases, an overdose results in death because a loved one thought the person to be snoring when actually they are overdosing. Other signs of overdose to look for are unable to talk but they are awake. Their body is limp. They have a pale, clammy face. Their fingernails and lips are blue or purplish black. Their breathing is very slow or erratic or has stopped completely. Their pulse is very slow or erratic or has stopped completely. Choking sounds or a snore-like gurgle, which is also referred to the death gargle. That is the noise my brother made when I found him, and you will know the noise when you hear it. It's horrible. Vomiting, unconsciousness, unresponsive to any kind of stimulant. If your loved one is in this kind of state, it is important to respond quickly and sufficiently. Dying from overdose is usually a slower process that lasts anywhere from a few minutes to a few hours. When suspecting overdose, you first want to assess. Ask yourself, are they breathing? Are they responsive? Can they speak? What is the color of their skin, especially around their lips and fingertips? If they are unconscious, try to wake them. Call their name or say something that they're not going to like you're going to call the cops. If that does not work, try stimulating them with mild pain. Run your knuckles up their sternum, or if they're wearing heavy clothing or they're in a position to where you cannot reach their sternum, then take your knuckle and rub their upper lip. Obviously, if they do not have braces or any kind of dental problems, or you can always pinch their earlobes. If they do not respond to any of the stimulation, then call 911. Do not try anything else. If they wake up, then try to get their attention. Check their breathing. If it is shallow or they appear to have tightening of the chest or shortness of breath, call 911. It is important to call 911 no matter how scared you are or how mad you think that they're going to be. It's not worth them dying over. Even if you administer Narcan, it is important to get them checked out by a healthcare professional. Let's back up for a minute. I will explain what Narcan is. Narcan, also known as naloxone, can help fix an opiate overdose. Narcan only works to reverse an opiate overdose and no other kind of overdose. It is administered by injection or sprayed into the nose and works by blocking the opiate receptors. The opiate receptor sites, which prevents or reverses the effects of the opiates in the person's system. You can, to get a prescription for Narcan and to be properly taught how to administer, you can either ask your doctor or Google search overdose prevention programs in your area. When you receive the prescription, you will get this and a syringe to administer, and they will give you a prescription to carry with that. You will need to carry your prescription with the medication. Back to procedure. While waiting for EMS, if they are breathing, you want to put the individual in the recovery position, which is slightly on their side, knee bent up towards their chest, and face to the side in case they vomit. If they are not breathing or stop breathing, then you will need to perform CPR. When calling EMS, it is important to tell them exactly where you and the overdosing individual are. Avoid using words like drug and overdose. When using those words, as bad it is to say and horrible as it is, it makes it not a priority. Instead, use not breathing and unresponsive. When EMS does arrive, then tell them about the suspected drugs so that the proper medical care can be administered. So with that, we have identified what an opiate drug is and some of the ways it is used and what it does to your body. We have also identified what someone looks like when they are being dependent on an opiate drug and what the signs of an opiate overdose are so that you can recognize and react. With recognizing the signs of an overdose, I have explained some ways to appropriately react so that you can save someone who is in overdose state. It is in my hopes that none of you ever have to experience this. When you have a loved one who is an addict, every day is a mystery, and you live in fearing the worst. Many times, overdose is accidental. They never intend for it to go that far, but the longer they use, the more it takes for them to achieve the high they crave. That is often how they overdose. If you suspect a loved one to have an addiction problem, or you already are aware, then reach out to them. They will most likely be angry, but it is always better to try. And educate yourself on how to recognize and respond to an overdose so that, if needed, you can save a life. My references are harmeducation.org, estate.memphis.edu, stopoverdose.org, and theguardian.com.